Urethra function. Why is there blood in my urine? Have you ever noticed blood in your urine and wondered what it could mean? Blood in the urine, medically called hematuria, can be caused by many different issues within your urinary system. The urethra, which is the tube that carries urine from your bladder out of your body, plays a key role in this process. When blood appears in your urine, it usually indicates bleeding somewhere along the urinary tract, which includes the urethra, bladder, ureters, or kidneys. One common cause of blood in the urine is infections. Urinary tract infections are quite frequent and can involve different parts of the urinary system. If the infection affects the urethra, it is called urethritis. When it affects the bladder, it is cystitis, and if the kidneys are involved, it is a kidney infection. These infections cause inflammation and irritation, which can damage blood vessels and lead to bleeding that shows up in your urine. Women are more prone to urinary tract infections because their shorter urethra makes it easier for bacteria to enter and cause infection. Injuries or irritation to the urethra can also cause bleeding. This might happen from catheter use, surgery, or physical trauma, such as a fall or accident. Sometimes, the urethra can become narrowed, a condition called a stricture, which can cause irritation and bleeding during urination. This bleeding from the urethra is known as urethroragia. Kidney or bladder stones are another common cause. These stones are hard deposits that form in the kidneys or bladder and can scrape or irritate the lining of the urinary tract as they move. This damage can cause blood vessels to rupture, resulting in blood in the urine. The presence of stones can sometimes be felt as pain or discomfort, especially if they block the flow of urine. Blood in the urine can also be a sign of more serious issues like cancer. Tumors in the bladder, kidneys, or urethra can cause fragile blood vessels to break, leading to bleeding. Sometimes, blood appears suddenly and without other symptoms, which makes early detection important. In men, an enlarged prostate or prostate infections can also cause bleeding, especially if the prostate presses against the urethra and causes irritation. Other medical conditions can lead to hematuria as well. Blood disorders, such as bleeding problems or blood-thinning medications, can increase the risk of bleeding in the urinary tract. Conditions like sickle cell disease or certain kidney diseases, including glomerulonephritis, may also cause blood to appear in the urine. It's important to remember that sometimes what looks like blood in the urine might not be hematuria. For example, women might notice blood due to vaginal bleeding, or blood from ejaculation can sometimes be mistaken for urinary bleeding. Proper medical evaluation is essential to determine the true source. If you notice blood in your urine, it is crucial to see a healthcare professional promptly. They will likely perform urine tests, blood tests, and imaging studies such as ultrasound or X-rays to find the cause. Treatment depends on what is found. For infections, antibiotics are usually prescribed. Stones might require procedures to remove or break them up. If a tumor or other serious condition is involved, more specialized care will be necessary. From a bladder health perspective, blood in the urine should never be ignored. It can be an early warning sign of bladder cancer or other significant problems. Early diagnosis and treatment are vital for better outcomes. Remember, everyone's situation is different, so consulting a healthcare provider for personalized advice is always the best course of action. Maintaining good hydration, practicing safe hygiene, and seeking medical attention when symptoms arise are key steps in protecting your urinary health.